Hello and welcome to the obtaining consent topic. By the end of this session, you should be able to understand why is consent taking important, when to take a consent, how to take a consent, what are the different types of consent available, the prerequisites of taking a consent, understand the additional special aspects to consent taking, and what to do when patient refuses to give consent. Let's get started. In general terms, consent is the voluntary agreement by a person to the proposal of another, the act or result of reaching an accord or a concurrence of mind, actual willingness that an act or an infringement of an interest shall occur. Sounds confusing? Let's simplify it. A person who possesses and exercises sufficient mental capacity to make an intelligent decision demonstrates consent by performing an act recommended by another. Obtaining a patient's consent is an important component of good medical practice and also carries specific legal requirements to do so. Except in an emergency where the need to save life is of paramount importance, the consent of the patient must be obtained before the proposed procedure, examination, surgery, or treatment is undertaken. Failure to do so may result in disciplinary inquiry for ethical professional conducts, codes, legal action for assault and battery instituted against the medical practitioner. So every patient as an individual has a choice whether or not to undergo a proposed procedure, surgery, examination, or treatment. The medical practitioner must inform the patient in a manner that the patient can understand about the condition, the investigation options, treatment options, benefits, all risks and possible adverse effects or complications, if any, and the likely result if treatment is not undertaken to enable the patient to make his own decision whether to undergo the proposed procedure, examination, surgery, or treatment. So there are few circumstances in which consent may not be required, such as seen in a medical emergency, which is defined as an injury or illness that is acute and poses an immediate risk to a person's life or long-term health. Other examples include emergencies where immediate treatment is necessary to save a person's life. Other conditions also exist, such as in situations where to prevent serious injury to an adult person, immediate and long-term health, where the person is unable to consent, subject to there being no equivocal written direction by the patient to the contrary. And lastly, when there is no relative or any legal guardian available or contactable during the critical period to give consent. In such circumstances, a consensus of the primary surgeon or physician who is managing the patient and a second registered practitioner is obtained, and the primary team signs a statement with the consent form stating that the delay is likely to endanger the life of the patient. Let's look at the types of consents that are available. Implied consent, which is a form of consent that is not expressly granted by a person, but rather inferred from a person's actions and the facts and circumstances of a particular situation, such as by a person's silence or inaction. Expressed consent may be in oral, non-verbal, or written form, and it's clearly and unmistakably stated. How about informed consent, a consent that we will frequently come across in our practice? Can be said to have given based upon a clear appreciation and understanding of the facts, implications, and future consequences of an action. In order to give informed consent, the person concerned must have adequate reasoning capacity and be in possession of all relevant facts at the time consent is given. Next would be valid consent. It can be defined as the voluntary agreement by an individual to a proposed procedure given after appropriate and reliable information about the procedure, including the potential risk and benefits, has been conveyed to the individual. Next, verbal consent. Verbal consent is given by using verbal communication and may be open to debate. As far as possible, it should be avoided. Lastly, non-verbal consent or cues is given by using non-verbal communication like nodding or extending the arm for a procedure, which are also open to debate. In such instances, it may be prudent to make an entry in the patient's notes that such consent was given by the patient. Let's look at the prerequisites for a medical practitioner before taking consent. So, the practitioner and the patient must have had met or known each other through previous consultation or contact in the context of a doctor patient professional relationship. The practitioner also has to be the one who's planning to do the procedure or operate on the patient, and it must be established with a personal contact with the patient. In other words, the two must meet before the intended procedure. The doctor must also explain to the patient the nature of the procedure and its objective, as well as alternative procedures. Lastly, the doctor must explain possible risk and complications which may delay or affect the result of the procedure, as well as influence the duration of stay in the ward or in the intensive care. A standard consent form should contain the patient's identification data, the name of the procedure or surgery to be performed in full, type of anesthesia, the name of the registered medical practitioner who is performing the procedure or surgery, permission to proceed with any additional procedure that may become necessary during the procedure and related to the procedure for which the original consent had been obtained, and a statement to the effect that the person who is performing the procedure has explained to the patient or the next of kin the nature of the procedure and the potential material risks. How about other additional special aspects to consent taking? So the first one is duration of validity of consent. The consent obtained in this manner is valid as long as the patient's condition remains the same. Should there be any change in the nature and clinical cause and presentation of the illness for which the consent had initially been obtained, then a new consent must be obtained from the patient. In situations where chronic conditions requiring periodic treatment, so good standard of care requires that consent has to be specific in time and the procedure for any invasive treatment. Next, consent for photographs and audio-visual recordings. So prior consent must be obtained if the practitioner is planning to take clinical photographs or to make audio-visual recordings before, during, or after an invasive procedure. Consent on admission and release of information. Well, for this, the consent for release of information and details on diagnosis of disease or management, including results of lab, imaging, and related investigations to employers or third parties, has to be specific and based on need to basis and not blanket at time of commencement of employment. Next would be consents for investigations for HIV infection. Because of the special implications to people who may test positive for HIV and the need for counseling and further management, specific consent has to be taken before the tests are carried out. Next would be consent for keeping organs or tissues removed at surgery for teaching purposes. Patients may request for specimens removed at surgery to be ritually disposed, and this should be complied with. In instances where such a request is not made, the surgeon may seek the consent of the patient or next of kin to retain the specimens for medical education or research purposes, but without having to reveal the identity of the patient. As for consent for sterilization procedures in a woman or man, it should be given by the patient concerned. And lastly, consent for release of patient data to another practitioner for treatment. A written consent must be given by a patient who is being transferred to another healthcare facility or medical practitioner for purposes of further treatment for release of relevant parties of his medical records. Now, what happens if the patient refuses to give consent? Generally, every individual is entitled to refuse medical treatment. A legally competent person has a right to choose what occurs with respect to his or own body. For such people, the right to refuse treatment exists regardless of the reasons for making the choice, whether they are rational, irrational, unknown, or even non existent. So, forcing medical treatment on a competent patient who has validly refused such treatment could be tantamount to an assault or battery. In summary, obtaining a patient's consent is an important component of good medical practice and also carries specific legal requirements to do so. Every patient, as an individual, has a choice whether or not to undergo a proposed procedure, surgery, examination, or treatment. However, there are exceptions to the rule that the consent of a patient must be obtained before those procedures in situations where it's risking the patient's life or it could be an emergency procedure. There are different types of consent, so know the consent that needs to be obtained before that particular examination, procedure, or surgery or treatment. And finally, understand that every patient has the right to refuse to give consent. So we have come to the end of this lesson. Thank you for your time.